आयच्या गजालींनी आमचे बरोबर आसा डॉक्टर दिलीप चक्रवर्ती, भारतातले नामनेचे कन्सल्टंट हिपॅटो पॅन्क्रिएटो बिलियरी सर्जन, म्हणजे जे लिव्हर आसा आणि पॅन्क्रियस आसा आणि जे आमचे पित्ताशय आसता जेका आमी गॉल ब्लॅडर अशें म्हणटात, ताच्यो ज्यो सर्जरी आसा तातले ते तज्ञ डॉक्टर. बँगलोरच्या HCG हॉस्पिटला कडेन ते असोसिएटेड आसात. बऱ्याच पयशिल्ल्यान आयल्या आणि ह्या कार्यावळीच्या निमतान बरीचशी मोलादीक माहिती आमच्या गोंयच्या लोकां खातीर, स्पेशली ज्या वाठारांत सोरो पिवपाचें प्रमाण चड आसा आणि आमच्या म्हणजे दुर्दैवान अल्कोहोलीक लिव्हर डिजीज किंवा सोरो पिवन फिगदाची दुयेंस किंवा लिव्हर फेल जावप हे प्रमाण गोंयांत खूब आसा. बरेचशे लोक ह्या खातीर दगावतात, तांकां मरण येता. अशा लोकां खातीर आजची जी कार्यावळ आसा ती अतिशय म्हत्वाची. ही सगळ्याच लोकां खातीर म्हत्वाची, कारण ह्या हिपॅटो बिलियरी पॅन्क्रिएटिक फेलियरान कशा पद्धतीची उपचार पद्धती, कशा पद्धतीची सर्जरी आज उपलब्ध आसा आणि वी कॅन गिव बेटर सर्वीस टू द पीपल सफरिंग, हाचे विशीं माहिती करून दितात आमकां डॉक्टर दिलीप चक्रवर्ती. डॉक्टर, वन्स अगेन वी स्टार्ट विथ अवर सेकंड पार्ट ऑफ द सेशन. I would like to know, we started discussion about the jaundice, which people feel it is a very common, but how to go about it is very important insight you have given. Now let's go to the cancer part or carcinoma of liver, what this thing is. So I would like to know what leads to this hepatic cancer and how you go about it and what are the clinical features.
So basically the causes what we discussed in the first session, alcohol, drinking alcohol can cause liver cancer on long term. And hepatitis B virus, a patient who is affected with hepatitis B virus, hepatitis C on chronic long term basis, that can cause aflatoxin. There is a fungal toxin which we take on the lot of plants and all, there is a aflatoxin that can cause a liver cancer. So these are the common reasons where the liver patient develops liver cancer. And any case which is cirrhotic liver, cirrhotic is a damaged liver, like cirrhosis can be alcohol or viral hepatitis or Wilson's disease. There are so many reasons where autoimmune cirrhosis, there is no cause, but patient immunological mechanism itself causes damage to the liver, or primary biliary cirrhosis. These are the different various reasons for cirrhosis. These cirrhotic livers are more likely to develop cancers in short term. That is one of the main reason where the damaged liver has more cancer cell formation and that leads to the liver cancer, what you call is hepatocellular carcinoma.
What are the clinical features, like how you?
Because if you compare India and abroad, there is no screening policy by any of the hospitals. Screening policy for the liver cancer detection is very remote. Not only in Goa, all over India if you see, because the liver cancer early stage is asymptomatic. That is the biggest disadvantage. It is asymptomatic. Unless you go for a routine health checkup, you cannot detect an early liver cancer, because the liver is such a big organ. One small tumor inside the liver cannot manifest any symptoms, and it will not present with jaundice also. Patient will have some vague symptoms, like if the tumor progresses in the period of 3 months or 4 months, then the vague symptoms like loss of weight, loss of appetite, is not feeling hungry, भूख नहीं लगेगा, हमको काम करने का मन नहीं लगेगा, some sort of weakness, uneasiness रहेगा, or थकावट ज़्यादा है, there is tiredness, feeling of tiredness, that will be there. So that is the place, that is the time where the patient goes to the doctor for just routine health checkup. At that time, if you can detect that majority of the liver cancers are curable. So that is the time. Second, आप जो second category है, जो clinically आपको पेट में आपको रहेगा कि कुछ गांठ हुआ है, the swelling is there, that is already advanced liver cancer, where you see and the patient has jaundice or severe vomiting or not able to eat food, because the tumor compresses the stomach. The liver is very close to the stomach. When it increases in size, it will put a pressure on the stomach. So that time it is already advanced stage. So that best time is usually asymptomatic. Any loss of appetite, loss of weight, all these symptoms should be investigated by basic investigations like liver function test, one ultrasound scan. Ultrasound is the common investigation, easily available everywhere in every look and corner of the city. So that is the investigation where the primarily detect the liver cancer. So that is the best modality. And screening, if you are, for example, if you are hepatitis B positive or C positive, you should be on regular screening or follow up. A patient should at least 6 monthly once ultrasound should be done, because once you know you are alcoholic cirrhosis, you are regularly drinking, and you are hepatitis B positive or hepatitis C positive, these people should go for an ultrasound regular screening at least once in 6 months.
I see.
And if you find a lesion, suspicious lesion like a 1 centimeter nodule, if you see, you cannot confirm that then it is a tumor or something like that. Then the next follow up will be 3 months. And if you see 2 centimeters above, you should go for a CT scan. That is where CT or MRI scan is also, that is where you will detect the tumors early stage.
So, doctor, I would like to know, like, see, apart from this liver cancer, very commonly people get those gallstones. How you go about it? Because now with your changing line in management, because earlier they used to have to do a big operation.
Yes.
What your laparoscopic surgeons, as a laparoscopic, what you offer and how prompt it is and how best it is?
No, gallbladder stones is a entirely different category. It is a benign disease. What
Yeah.
we are talking before is a
Yeah.
liver cancer.
Yeah.
It is a benign disease, very common disease, and with the easy availability of the ultrasound, the stone diagnosis is more and more common. So it is a very simple operation. It is done laparoscopically. It is a daycare surgery. Morning comes, patient gets operated, evening goes home.
Because why I asked this question, because it is quite common in Goa and lot of
Yes.
females, maybe once upon a time, fat fertile female of 40, but I
Yes,
don't know.
40 years, but nowadays we are
it is
seeing
common.
patients of 10 years also, patients of 80 years also.
Correct.
It is not, it is a word very common in the fat ladies who, fertile ladies who have children and all. But it is not sticking strictly into that. It can affect any, it's very common disease. It is not very complicated thing. And it is a common simple operation. It is we are doing at a daycare. Morning patient comes, get operated, evening goes home, and he comes for stitch removal or depends on the type of stitches, or he need not come again.
Achha. Doctor, now back to the cancer of the liver. What are the newer modalities, like what is coming up in your transplant, how it is effective, what role it has to play, or what role or what future you see in all this type of patients who have already been diagnosed or detected as a case of cirrhosis of liver?
So, cirrhosis of the liver and cancer, two different entities. Basically, now we will discuss about the liver cancer, where the liver cancer, if you see a liver cancer which is a reasonably resectable stage, best treatment is the surgery. If you can cut the liver, half of the liver or 1/3 of the liver, 1/4 of the liver, remove the tumor part, that is the best possible treatment for the liver, provided that you diagnose the tumor in the right time. If you are dying right time, you send the patient for surgery, we can resect the part of the liver and patient gets cured.
I see.
But after 5 years, because 5 years are only 70%, 60% in non-cirrhotic livers. If it is cirrhotic, then life duration, if already damaged liver, then the longevity of the life is less. Second option is, if the patient tumor is big, it cannot be resected, then the two options, embolization. We'll cut the blood supply of the tumor by embolizing, by put a cannula through the vascular route through blood vessel and try to block the blood supply of the tumor. The rapidity of growth of the tumor gets to come down. It is called TACE, transarterial catheter embolization.
I see.
So that is one. Third option is radiofrequency ablation. We can put a needle directly from the skin, and under ultrasound guidance or CT guidance or laparoscopic guidance, we can burn the tumor. But it has own limitations. It is 5 centimeters, up to 5 centimeters we can burn the tumor. Beyond 5 centimeters we cannot burn the tumor. So best treatment as of available is liver surgery, resection of the tumor.
What is the role of this liver transplant and where it comes into picture, where it is done? Because I don't know how many centers in India are doing this, and what is the success rate? Everything, whatever you would like to add on this topic.
Liver transplantation, because these patients, one is cirrhotic livers, what we discussed, the first part is cirrhotic, second is liver cancer. Both the patients are suitable for transplantation. Cirrhosis patients, they cannot be reverted. The liver is permanently damaged. If you don't do transplantation, the patient going to die in the next 2 years, 3 years, 4 years, depending upon the amount of damage. So these patients require liver transplantation. The second category is liver cancers. Liver cancers which are early detected stage with a cirrhotic liver. A liver with a liver cancer, underlying cirrhosis which cannot be removed. Because if a normal liver will cut the liver and remove. If already damaged liver with a tumor, you cannot remove that tumor. If you remove, that patient dies of postoperative complications. That patient is also fit for transplantation. So what basically liver transplantation is that we remove the native liver, whatever the diseased liver, we remove the entire liver and use another person's liver. He may be a living relation, he should be a relation of the patient. We can use half of the liver, take from the donor. It is called a donor. A donor gives the half of his liver to the recipient. What we see in the kidney transplantation. Kidney, you have 2 kidneys. One kidney you remove, the patient is okay. So kidney transplant is less complex actually. If you compare a liver transplant, is the most complex abdominal surgery so far available in the world. So there are not two livers. So we have one liver. We have to cut into 2 pieces and take part of the liver to use it in the donor. The second option is the patient dies of trauma or accident. It is called brain dead donor. Usually if you go to neurosurgery ICU, neurology ICU, a lot of brain dead patients will be there. They're already brain dead, but the heart, liver and are working because the support.
Yeah.
That is, they are the suitable patient to donate the organ. Organ donation. So if the patient family is willing to give consent that donation, my relation's organs can be donated, or there is a donation card, patient before everybody gives a consent, the donor card. He carries a donor card that once I die, all so and so organs can be donated. He gives prior consent.
Yeah.
So then the liver can be removed from that patient. Not only liver, he can donate his kidney, he can donate cornea also, anything. So those liver is a full liver. That is very good actually. If you get that liver, what we are using is a small part of the liver, half of the liver we are using, 60 up to 65% of the liver can be removed. If I have 100% liver, 35 to 40% I need, rest can be removed.
Correct.
Because the good thing of the liver in the body is the only organ, once you cut the liver, it regrows and again it's normal size.
I see.
Only it's like hair, nail and all. The liver grows once you cut the liver, in the next 1 month time, it grows 80% of its normal size. It cannot be completely normal.
Yeah.
Even you see after 1 year, it will not 100% normal, 80% of the normal size it regains.
Uh-huh.
So that is one beauty of the liver, that it grows. So this liver can be used, but when you get a cadaver liver, that like a brain dead patient or somebody voluntarily donating after death, then this liver is very good. You have a big liver and the patient, even the sick patient, it can be transplanted. So this is the liver transplant. And donor, who are the donors? Suitable donors is above 18 years up to 65 years we can take the organs from the donor who can. And according to Indian government regulations, he should be relative, 3 generations up and down, he should be relative of the patient. That is what liver transplantation. The transplantation is a very complex surgery. You have to take out the native liver, put the second liver which is original liver, and operation time goes to 10 to 12 hours.
I see.
10 to 12 hours, simultaneously 2 teams will operate, one on the recipient, one on the donor, they will operate. And after surgery, the patient has to be in the hospital at least 2 to 3 weeks. And the cost of surgery is also very high, it comes to 18 to 20 lakhs. That is the lowest ever possible where we are doing in HCG hospital now. In Bangalore, we are doing HCG liver transplantation, we are doing at 20 lakhs, which depends on the patient again, because poor patient we can negotiate and we bring the expenditure. And after transplantation, patient has to come to regularly for us follow-up every month in the first year. Then if he is doing well, then gradually frequency of visits may come down, but regularly follow-up for lifelong. And after transplantation, you should have immunosuppression, because you are taking another organ that this body has a tendency to reject the organ. So to that rejection capacity we have to suppress. So that is what called immunosuppression, like what we give in kidney transplantation, he has to take medication for lifelong. But in the liver, if you compare the kidney, the rejection capacity of the body is very less. The liver can adapt to more of rejection. I see. And it can adjust to some extent. So immunosuppression dosage is very less compared to the kidney.
So compared to, you mean to say this is better option. That means compared to kidney, liver takes better chances of adaptation. Doctor, I should thank you very much for all these efforts which you have taken to come all the way to our studio, and viewers of Prudent. I'm sure they are getting a lot of insight, they are getting a lot of knowledge, a lot of material, and I'm sure that, let's hope that nobody suffers, but in case if somebody suffers, they should know like what are the modalities of management available. I would just like you to tell our viewers just take home message, and we'll wind up with this program.
Take home message is, drinking is very common in Goa, not only in Goa, every part of India the social drinking is common. If the liver gets, you feel that the liver has some problem, go to a doctor, investigate what is the cause, and if there is a jaundice, look for whether it is a surgical jaundice or medical jaundice. And once you find that there is a tumor in the liver or pancreas or biliary system, it can be cured. It is not that the tumor, because the center, it depends on the expertise, availability of the expertise, availability of the infrastructure of the center, expertise, it depends on the surgeon also. So these are the hepatobiliary tumors are complex surgeries, and it requires a lot of expertise, infrastructure, a lot of training. You should go to a suitable center and get it rid of. It is not that I had a liver tumor, I am going to die. It is not like that. The options are, those days are gone. Your liver tumor can be removed, your liver can be replaced by transplantation. So every lot of modalities, every disease can be treated up to a certain extent.
So let's hope that all of us will live a healthy life, and we pray to Almighty for a healthy and happy life to everybody. Thank you very much. So nice, sir.